Welcome, everybody. I am thrilled to be here again. As everyone knows, or I hope everybody knows, we are a group of women, immigrant businesswomen, and our group is called Immigrant Businesswomen Circle. And we are together to support each other, help each other, and do whatever we can to help each other get our businesses going faster and better, and work through all the little ins and outs that we as immigrants, women with accents, sometimes have to deal with. I am super excited today that we are spotlighting Blanca D'Levy, founder and president of B&B's Group LLC. She's a licensed health and life insurance agent. Welcome, Blanca.
Thank you, Beatriz. It's a pleasure to be with you. And like you said, we are women that are immigrants and then also with accents. So, which is sometimes a little bit difficult, but sometimes not, because it makes us feel part of a circle.
Well, Blanca, I know your story and it's fascinating, and I am grateful to be your friend and have heard it. But would you share with us your story on where you're from, first of all, and how you came to the U.S., and then how you ended up in insurance and then a business?
Okay, well, thank you, Beatriz, for making this space for me and for everybody who is part of the group. Because my family and I came on 1983, December of 1983, which means it's around 38 to 39 years ago. It was just, unexpectedly. We never thought that we were going to stay here for more than 1 year, because my ex-husband came on a mission working for the government. And then we stayed because an non-planned event happened in our lives, which means that my daughter Debi, I was pregnant when I got here. And then we were thinking of getting back to Mexico within 1 year, which it was really good. But then life and God have different prospects for us, of different idea of what it was going to be our life. And then she was born when I was 24 weeks pregnant, which means that she was very teeny tiny baby. Actually, she was not even a baby because a lot of her organs were not completed yet. And then we were blessed, and she was blessed by the fact that she was born here, and she's a miracle baby. She was 1 pound 6 ounces, which is teeny tiny babies. And then from that time on, our life just turned in a different position than we ever thought. And sometimes you have to be prepared for the future, but there are things that you cannot be prepared ever in your life. And then we stay here, and then by the time that Debi left the hospital after 6 months, we realized that this was going to be our country, because that was the best place for her to be in. And I am very grateful, I'm very thankful to USA, because in addition to giving me the opportunity to develop as a businesswoman and being able to work and provide for my family, we were blessed with Debi, because she has been able to get everything that she needs. My life, basically, working life started when I was in 1987, and then from that time on, it was just like almost every immigrant, when you come and you do not know where to go or what you're going to do, and then you start working on whatever comes your way, unless you have a plan, and we didn't have a plan, so, and then, I could say that I'm happy that I was able to make it up, because my first job was cleaning offices, because I didn't know if I could do it any better, I didn't have any clue. And then I went to Burger King, and then I worked for a mortgage company, and then little by little, with a lot of work and effort and commitment to my children, to my life, and to working, to the companies that I work, I was blessed with the fact that my last job was as a financial manager for one of the mortgage businesses that I worked. And then, so it was nice. It was a very nice road because I learned a lot. At some point I was human resources manager, and one of my responsibilities was to be working as a business administrator, which allows me to know a lot of what I apply now. So the same with Debi. Having a handicapped child puts you very close to the health system. Very, very close. You have firsthand experience. And then after I finished working, then the meltdown of the mortgage business came, and then I decided that it was time to explore different opportunities, and use the experience that I have get through all those years, this time building my business. At the beginning, I wasn't sure what I was going to do. I just knew that I wanted to have my own business. But then one day, somehow, and I'm always saying that it's God's willing, put me on the help. And when they interview me before they have to sell it, the idea to me, I knew that was what I was going to do. It was a call, it was a call inside of me.
So, Blanca, I have a follow-up question here. So
Yes.
you went through all these medical issues with your daughter. Can you just for a second give us a little insight on how difficult it must have been with English as a second language? Because I know that at that time, years ago, there were no nurses that spoke Spanish, and how you were had to go through all that, trying to figure out what you're being told and making decisions based on what you're hearing and understanding.
It was just, you just put me in touch with, you just took me many, many years ago when we had to go to the ICU. And my ex-husband and I will walk into the ICU not understanding a thing, having meetings with people who are with doctors and with everybody, and all we did was smiling because we didn't know what to say, so it was very difficult. But then at the same time, you get to know a lot of angels. I always said that the people who really help you are angels. And then at that time, it's just so weird, Beatriz, because at that time I decided that if ever I was going to be able to help somebody to go through whatever they need to go through and help them, I will, And now with the business that I have, it's not just a business, it's a passion, it's commitment, it's knowing that the customers know that I am on their side. That for me, even though it's my business, what is most important is that they get what they need, and if I cannot give them what they need, just to help them go where they can go. The good thing about Debi, and I guess that's the best way that you can use your experience, your personal experiences, by helping other people, because you know what you have to go through and you learn from it, and then having Debi help me have access to a lot of things that people do not know, you see. And
Right.
then these, I have had beautiful experiences in a sense that I know that even though I was not going to sell insurance, I knew they were going to be helped. People who really, really, really needed insurance at the time, that needed help, people with cancer, people that are pregnant and they didn't know where to go. So on. And for me, that's really the beauty of what I do.
Thank you for sharing that. I know that it's a very difficult time in your life, and I took you back there, and I'm sorry, but people need to know why you're so good at what you do, is because you've been there, because you feel for them, because you understand what they're going through, and that is so important. I came as a child, and I had that kind of issue, but as well. Thank you so much for sharing. That is so important. Tell me, we're going to put your webpage and all the information so that people can reach you. But you're coming to you're in a very important part of your business right now because of open season, it's called?
Open enrollment.
Open
Yes,
enrollment, sorry.
yes.
Okay. So give me just a quick shout out to that and tell people where, why it's important for them to research or to come to you and find out if they have the right insurance.
Okay, open enrollment season. Actually, it comes from usually, and it's important for everybody who's listening, comes from November 1st. And usually, if you want to be insured by January 1st, they have to be enrolled by December 15th. However, the government has extended that time, and then if you decided your insurance to be started on February the 1st, you can extend and enroll by January the 15th. However, as you guys, everybody who lives in this planet Earth, because of COVID, sometimes it changes, sometimes government extends, but you cannot we don't even know when they are going to extend, what states are going to extend. So whoever wants to look for insurance for it, and if you want to get insured by the 1st, January the 1st, by the 15th, you can be enrolled. December the 15th, if you want by February the 1st, make sure that you enroll by January 15th. Now, there are two ways that you can get your insurance usually, is looking on the internet and calling the companies, or looking in the internet and look for an agent. I will always tell you, go and look for an agent, because we are not just trained and certified, but we have to be licensed to sell insurance, to provide that service to the customers. And because of that, we have to have knowledge on how to guide the customer to whatever really fits their health needs, their income needs, their budget. There are many, many things to take into consideration. When we talk about immigrants, there are so many different immigrant status. You don't even have to be illegal, and we are not talking about illegal or not having papers. There are many, 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 many statuses, and they can still apply, but they need someone who really knows how to guide them. So, if whoever is looking, if you're an immigrant, call me. Try to find an agent. I am licensed from 20 different states, and usually because since COVID, I do my presentations on Meet, on a video chat, and I present everything. And I can tell you that until this point, nobody has been disappointed or going without any answers. But this is the time.
Thank you so much for sharing that. And as entrepreneurs, when you start your own business, you don't have insurance, and that's how I met you.
Yes.
Because I had no insurance and I needed some help getting some sort of insurance while I ran my business. Mm-hmm. We're going to run out of time, so I want to take a minute first to thank you so much for all of your time and efforts to talk to us and share with us your knowledge and your wonderful, wonderful story. And the last thing I wanted to ask you was, you have been in our group since the beginning, and I wanted to know if you could give us an idea on what you think about the group, why you're part of the group, and what you've gotten out of the group as a business owner and as an immigrant businesswoman.
Well, for me, it has been an awesome experience because I have been part of different groups, I'm in a lot. And the difference between this one and the rest of the groups is that we really, 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 really care about each other as women, as entrepreneurs, as people, as human beings, so, and usually when you are on a group, is like we come and then we are trying to figure out how we are going to sell to the next one. In this group, is just a completely different experience because it's a social group. This amazing group allows us to get to know each other on a personal basis, and because of that, the knowledge of that person never goes. In addition to that, talking with other members of the group, it's a very safe group where we feel that we are important just for who we are, not because of the accent, not because of where are we coming from, not for anything else, or the journey that we have to do to get here. So anybody who is listening and is going to listen, I invite you to at least just come once and be with us, because Beatriz, when she founded this group, she founded with the purpose and commitment to help women to get together and to support each other, and she is fulfilling that commitment.
Thank you so much, Blanca. Thank you so much. You are such an important member of our group, and we enjoy your company, and we enjoy your knowledge and spending time with you. And I just want to thank you for taking this time as well. Thank you so much, and we will get in touch and talk some more later. Thank you. Thank you so much.
Thank you, Beatriz.